Hi, my name is Dr. Meredith Warner, and I'm a fellowship-trained foot and ankle surgeon and orthopedic surgeon in Baton Rouge, Louisiana. And I want to talk to you about Hallux Rigidus, or some people call it Hallux Limitus, which is essentially an arthritic condition of the big toe, at the main joint of the big toe. It's very painful, it limits motion, and causes a whole host of problems in the foot. If you have this condition, you know this, and you may have already been offered an insert called a Morton's extension that puts a stiff piece of material under the big toe to limit motion. You may have been offered different shoe wear or told to stop running or stop being active. If you've been offered surgery, you may have been offered what's called a chylectomy, which is a traditional way to clean up or get rid of the arthritic osteophytes and such in that joint for early stage disease. You may have been offered a fusion, which is probably the most common procedure for this. Unfortunately, a fusion connects this bone to this bone with a plate or screws, and then you have no motion. It's effective for getting rid of the pain, but you still don't have a biomechanically correct foot. Another option which is present is joint replacement, which you can replace one half of the joint or both halves of the joint, and that's with metal and plastic implants, just like people you know that have total knees and total hips. Unfortunately, those tend to loosen over time and have to be revised, and often if they're not put in just right, or if it's a wrong implant, or for really any reason, they can fail. Another treatment that has been tried in the past, which I've tried, is called Interposition Arthroplasty. This used to be used a lot for professional athletes, where you actually take a piece of tissue, a piece of tendon or fascia or fat or something, and just put it between the two pieces of bone to try to give a bumper. All of these treatments work for a limited way, but none of them have been perfect. But now we have a great new cutting-edge advanced treatment option that just got FDA approved recently in this country. It's called CartEva. And this is effectively a bumper put into the joint that's like a cartilage replacement. It's a synthetic cartilage. This is actually the device itself, and it's actually made from the same material that might be in your contact lenses or a similar material. And what happens is we make an incision, open the joint up, clean up all of the arthritis, and essentially put the bumper right where the worst part of the arthritis is, and then close it up. So you effectively replace the cartilage, so it treats the pain, treats the motion problem and gives you motion and lets you use your foot normally and naturally. This is a surgery I've been offering my patients for the past year or so, and it's been extremely effective. I'm very happy with it. So if you have Hallux Rigidus and you've been offered a fusion and don't want that, which I don't blame you, or you've been offered one of these other treatments we talked about and you want to explore something a little bit more advanced, I would suggest you look into CartEva, which we do at Warner Orthopedics and Wellness.